Okay, what do you guys think about the situation?
Okay.
Yeah,
So
thank
I
you.
feel kind of bad because I was supposed to do like communication, but it was kind of hard because like she was doing meds. So
Yeah.
I just tried to gather information that then Mary could use while she was on the phone with the doctor. But yeah, we had another technical difficulty
Yeah.
with the one phone.
Yeah.
Kind of-
That was
So you guys didn't have a phone until they dropped it off from another scenario?
Yeah.
Well, they would just had it over there and they were using it, and then they had like I was waiting, and then so
Oh, okay, sorry. about
so like noticing her blood pressure was high, I was like, let's call to get something, but then they were like, well, what's your blood pressure? And we're like, well, we're waiting. Like I feel like they were like, well, why aren't you doing this? And we were like, we're trying to do that. Like but overall, I mean.
Yeah, you may run into that in real life too,
Yeah.
where the patient or family are pressuring you to do something, but you have a job at hand.
Yeah.
So you may have to say, I promise we're going to address that. I just need to finish this task first. So mitigating those types of conflicts
Yeah.
is definitely a real part of your job. So, what else? Anybody else have any other feelings about it?
just like putting everything together. Like there was just a lot.
Yeah.
Error check. I was like, okay,
I was
guess
looking
do it.
at,
I'll
like,
do
there's so many-
it.
like I just need to get more familiar with these tools, assessment tools, so that it's not like so mechanical. Like I can just be talking to a family member and the
Right.
patient and just kind of know what I'm hearing rather than like boom, boom, boom.
Right.
Not that I'm also like, one sec.
Yeah.
Oh, it's
I mean, some
Yeah.
of it's just a fictional part, but yeah, I just want to get a little smoother with.
Yeah, that will come with time, and then it will ultimately become a conversation that you have, and then you've kind of made all those assessment points
Yeah.
casually or with muscle memory.
Right.
Yeah.
So, yeah, you guys are just beginning, right?
Yeah.
So you guys are gonna be fine. Don't worry yet. Don't worry just
The meds
yet.
and everything, I definitely felt the like confused, like trying to get them when there are other groups also there trying to get their stuff was like, wow, like
Yeah, that's a-
and everyone's like, do you know where this is? Do you know where this is? And I was like, I don't know. Like,
Right.
it was like I feel like a good reminder of being like double check, like check at the bedside.
Yeah, you're exactly right. So
And I forgot to,
distractions.
before I gave it to her, I forgot to verify her thing again. I noticed that the second I did it. So.
Right. Yeah, so you guys will build those habits, but you're exactly right. When you're pulling medications, when you're pulling medications out of a med cart, you will have other nurses waiting in line. You'll have people asking you questions about your patients. Your phone may be ringing, and that's a perfect place to make big mistakes. So make sure that you're using your double verify. When I'm pulling meds for patients, I verify it on the MAR, so I kind of know what I'm looking for before I get to the medication card or the Pyxis. I verify against, you always pull it up. If there's a computer next to your medication machine, pull it up and just verify as you're pulling it out. Because I have also pulled meds out of the Pyxis that were stocked in the wrong hole. So it pops up and
I did that here.
Yeah,
That's the same
right.
hole, but I was
so
like,
it's very important for medication safety that you are doing those double, triple checks. Always check when you're at the bedside with the patient too.
Yeah.
And then 5 rights will help guide you, but you're gonna want to have those habits too.
Also, quick thing, we need to be done with debriefing and briefing for the
You had
next
said at the
scenario
beginning that
by
she said she was in pain.
10,
That's
10.
why.
Okay.
patient care by
Got it. Okay.
No medications
All right.
haven't
10.
been given yet today. Because then, like, you still have to ask the patient, like, even if she's
Directly,
confused,
yeah.
like, because then like, I didn't even think about it until she's like,
Yeah.
what's your pain out of a 1
Right.
to 10?
Right.
10, you're on a vacation. Or no, what, 0's on a vacation. And 10 is like, I don't know
Yeah.
what the other one is.
But yeah, I was like, oh, we're giving you a pain meds, so we haven't
It's not
actually
an
asked
idea.
her.
Yeah.
Yeah, you always want to document. Like you want to know what the pain is before you.
So I can't feel my mom's pain.
Right.
Well, that's why when I was asking her what I wanted to give her, like if she wanted it, and she said yeah. But you're right that I didn't get the number.
But if the
for it.
patient is confused, what's your next option?
Just looking.
Like
Yeah.
yeah.
Yeah, the visual assessment. Yeah, the other pain assessment scales that don't require her to verbalize it, but maybe grimacing.
I should have said that.
Yeah.
Yeah, but you look like you're grimacing, so we're gonna give you.
Right.
Well,
Or
it's like funny because like they would say things and ask for like and I just took the blood pressure and then the like thing was like, have you taken my blood pressure yet? And like just kept like repeating like, have you done this? Or she's like, it looks like it does your mouth feel dry, and they're like, silence.
I feel like there was a lot going on in the room that we would like. I was like, did you hear me? What meds I have for you? And she was just like,
Yeah.
like
Yeah.
No
I
noise.
saw that.
yeah, like kind of just.
So you
I
kept,
feel
like,
like they were
repeating.
distracted, so we were kind of like waiting.
waiting. Yeah.
Just get over the fiction.
Yeah.
Right. Let's see. So anything significant in the assessment that you guys found? Anything abnormal? So we,
What?
You guys found the BP, the high BP, the order.
Yeah.
okay, so you guys
The
discovered
blood
a high
pressure.
blood pressure, and you guys were able to call the physician and ask for the medication.
Yeah.
Eventually.
Yeah.
Right. Okay, good. How did your S bar go? Is that you?
Yeah, it was good, but she was asking questions that I hadn't thought were like getting out of bed to pee, which like maybe it's a side effect of one of the medications that she would urinate a lot. That I'm like giving the vitals, and then she was like, "Well, can she get out to pee?" And I was like, "I don't know, can you?" Like things like that I would just hadn't thought.
Right.
Were part of it,
So like
but-
when you're in your nursing role and you're giving medications, you're going to be like looking up the
Right.
nursing considerations. So that would be something that hopefully you'd be familiar with.
Yeah.
It will also come with time as you get more familiar with medications. You understand how they impact the patient. I thought your S bar was really good. And then what about when you communicated labs to the family? You may have thoughts.
It was good, except for I had no idea what the red blood. Like I was kind of just like that could
Yeah.
be.
So my advice would be to try to tell them in layman's terms.
Okay.
So when you say, you know, you have high white blood cells and your urine analysis and all of that, so you can just say there are some white blood cells, which shows us that there's a little bit of an infection in the urine. So it tells us you have a urinary tract infection. But I think you said something like it would support the hypothesis that. So
Yeah, it did not sound natural.
I know, but I mean it is. It's good, but the family and the patient may just look at you because they
I did
don't.
that with you.
Yeah.
I'm sorry about that. She's like, there's a we think she has an infection. Like, then why are you giving her an antibiotic before like there's a confirmation? And she's like,
They will.
we know
They
there's.
will.
No,
though.
but I
That's
said
awesome.
waiting for the labs and they will know.
Like,
Yeah.
I said it.
Well, no, you did, but it was just kind of funny because like there was like I think a slight like people were like thinking in different rounds and like they're like, oh wait, I should talk to everybody else
I mean, like,
because she told me one
it's
thing and then
hard.
you told me one thing. And
Yeah.
like,
So how did the nurses interact with you? What was your feelings on that?
It was good, but there was definitely sometimes I was like, wait, I'm like not a nurse, turn off. Like
Yeah.
I know what like you know the hematocrit is and stuff, but I'm like, okay, but like what does that mean? And then like I did nitpick on her. I'm sorry.
Oh, no, that's
for
fine.
saying like, what do you mean there's a like you think there's a UTI? And
Good.
then
Yeah.
now you're giving her an antibiotic for something that you think, and I would like confirm that.
That could be. That's a real situation too. So yeah, you want to be confident in the medications and the indication for the patient. So why? I have walked into plenty of patients' rooms with a handful of meds, and they're like, "What is that for?" You're like, "Well, you know what the medication is for, but perhaps you don't know the actual indication to the patient." And it doesn't. It's not a good look, right? Because
Yeah.
you're like, well, the doctors wrote it for you.
Right.
You know, it's not really like a good reason. So that will come with time and experience, and even when you get to professional practice like me. So
And there was a bit of confusion, but I think that's also like 3 people acting as one nurse. Like,
Yeah.
some of that would be
confusion, I could
super
double
Yeah.
Yeah.
No, I think it went like super well.
Yeah.
and then,
It actually went really well, but I was like,
do you think you guys communicated well together as a team? Okay, good.
We noticed also with the phone order that Anna should have listened to it too before I hung up the phone.
Oh.
But yeah, it was like
Did you do verbal read back? Did you do all of if you
I just
listened-
had him repeat it. I didn't read it back. And
Okay.
I realized I should have. So
Yeah, so the closed loop communication, you receive an order and you state it back, so that, and then they confirm that they heard what they said, right?
Right. Yeah.
And do you need to have, like, is it even better if like another nurse listens to it? as
No,
well,
not
or
necessarily.
like,
No,
have
like the
that?
protocol will be the closed loop communication. So if he says 10 of blah, 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 10 milligrams of this by mouth one time, then you
Right.
repeat that directly back, they confirm. And then that is your order. And then you can enter it in the computer. It depends on the hospital and how the protocol is set up for you guys. But yeah, you want to make sure you do the full.
Okay.
But otherwise, then you'll do really good. We're going to start talking about scenario 2 now. So, old books go away, new books come on.
I'll take your med.
Okay, so your next group of you guys right here.
No, there's only 3
Let's
now.
see.
Well, we only do 3.
Because yeah, what is the
Who's the daughter?
Yes.
I would assume the daughter's probably still going to be there. Let me just double check.
You're gonna be.
Well,
Commencers last week. Your mom and then.
oh, yeah. They cracked up.
You know, I wish I had seen a video of that because like Crystal was telling me what was going on, and I'm like, oh, poor Giovanni.
Oh, I felt so bad. But I was,
Oh, here's the
I was trying
times.
to make it difficult.
Here are your times.
Oh my god.
Okay, so there is going to be the daughter again.
Dr.
Oh, Ashford, I was trying to find the name of the doctor here.
Yeah, like,
Yeah, that was
I
blank.
could not.
There was no
find it.
assigned
Oh, okay.
position.
Oh, maybe because they had like a she's
Wow.
on new.
That's what I, yeah.
Okay, who's going to play the daughter?
Scott.
I mean, this girl.
Okay, that's fine. You can be the son.
We can switch it up.
There you go.
Oh.
So I think it's
Are you so excited?
So get familiar with those.
easily puts hair back.
Okay, so now,
The difference is just her.
all right, report for the second scenario. It's 3:30 p.m. the following day. So you're getting a report from the charge nurse. Millie Larsen is an 84-year-old female who was admitted yesterday evening with confusion, hypertension, and urinary tract infection. Her blood pressure medication was resumed, and she was started on antibiotics and IV fluids. She has 450 mLs of amber urine out. She has had no pain during the night. She had a near fall about 6 a.m. when she was trying to get out of bed to the bathroom. She has no visible injuries, and her primary care provider and her daughter have been notified. She may be discharged later today, but she does live alone, so her independence in activities of daily living should be assessed before discharge. Also, I didn't have time to do her falls risk assessment. Would you please be able to get that done this morning? Ms. Larsen has discharge orders. They're on the chart. The physician wants to be notified of her assessment results when they are done, but I haven't started any of the assessments. I need to get a patient ready for surgery right away. Her daughter just got here. I think Miss Larsen, her son just got here.
Yeah.
I think Miss Larsen has had some meds due before she goes home, and she needs education about all of her medications.
So to get discharged, she needs education on her meds. We need to see if she can perform her daily activities and then Melissa can She's telling us.
Wait, did you say she's getting ready to be prepped for surgery, or she just got out of surgery?
No, the charge nurse needs to go get somebody else ready for surgery, so that's why she's passing on some tests
What did she
here.
forget to do that she
She
has
just
to
can't
do?
pee right.
She said
Activities?
she may be discharged later today, but she lives alone, so her independence in activities of daily living should be assessed before discharge.
Right.
Also, I did not have time to do her falls risk assessment. Would you be able to get that done for me?
It's fall risk scale.
And she has some meds that are due before she goes home.
But, yeah, this is the one that they.
Okay, so the learning objectives, the things we're looking at this time, our goals for you guys are to perform a physical and functional shift assessment, assess the patient's individual aging status and using the appropriate tools. So the tools are going to be the CATS Index of Independence of Daily Living, and then assess the caregiver's stress. So the tool is the Modified Caregiver Strain Index that you guys have. Communication effectively with the patient and members of the patient support system, safely administering medications, and communicating effectively with other members of the team. Y'all ready? We have 1 minute before go time.
Go Mary for printing everything out.
3:30 p.m. Yeah.
So is the time after that?
Yeah. So our time starts. So time is 13. I'm sorry, 15:30.
Time for that after, for today,
Oh, those are the times that they're due.
Oh, those are due time. Okay.
Yeah, yeah. Sorry, it took me a while to look through it myself.
It's so hot in this room.
All right, you guys are go time.
Here's the CATS independence living one, and here's the fall risk one. There you go.
Okay, y'all are on.
Symptomatic depression.
Bye.
So great. This chair is hot.
Huh?
This chair is hot.
Yeah, no, those chairs are warming too.
Yeah, that's what I just came out of because I didn't sit very long. These are before I leave, you know.
The phone thing, I think, is so that like of all the things to just not order two more phones. Like if or like don't have one parents, like don't need a phone. Because like we're sitting there looking at the high blood pressure and then we're being like,
No, and like we're getting like told to choose and there's only one, so I'm like, okay, that would have been nice for the first one.
Yeah. So my phone, I just think it was the phone.
Yeah.
I thought you told us that before.
And I thought that was probably really hard for us to get a lot. But it's like, more in my, because we like are like responding. Yeah.
Hi, Miss Larsen. Hello. Hi. And you are her son? What is her name? Dana. Okay.
It's Dana.
So I'm just gonna go ahead and he's European. Ready for discharge, right?
He's a sweet. It is hard to hear.
So I'm going over medications, working with the adverse effects for those and the dosage. We're gonna make sure that you can do everything you do in your house. And do we know that you're gonna be Thank you. Thank you.
Oh, that's nice.
Can you get
privacy?
No, I said open the curtain. Because the person has to
They
see.
did close it to the privacy, but
Are you going to take her home?
The person's like,
Dana?
Yeah. I wanna, be with her.
Yeah. She's living at home, right, by herself?
She is.
Okay. So you're gonna take her home for visit? Just make sure she's situated? There's probably some tips